Hi, my name is Taylor Collins. I'm an MSOT student at Kaiser University, and today I'm here to talk to you about an ischemic cerebrovascular accident, also known as an ischemic stroke. Neuroanatomy affected by this condition would include the brain. Depending on where the ischemic stroke is, affects the client differently. It may also affect the retinas or the spinal cord due to an underlying cerebrovascular disease. Causes of an ischemic stroke or CVA is due to the brain's blood flow becoming blocked or narrowed. This can occur when fatty deposits, blood clots, or debris throughout the body traveling in the blood become lodged in blood vessels in the brain, reducing or blocking the blood flow. The etiology of a ischemic CVA is thrombic or embolic event that impairs blood flow to the area of the brain. Thrombic means that the blood flow is obstructed within blood vessels due to a thrombus or a clot. Secondary to inflammatory conditions, embolic is debris from throughout the body that blocks blood flow through vessels. This may be due to plaque. The etiology of a stroke affects prognosis and outcomes. Clients over time may recover fully, or others may have long-term complications. The need for OT can support and enhance the quality of life. The prognosis involves assessing various factors such as the type of stroke, its severity, the extent of neurological deficits, comorbidities, and the response a client has to treatment. Make sure to look out for the signs. Remember, FAST. F is for face. Droop on one side or both sides of the face from muscle weakness or paralysis. A is for arm. One-sided weakness when lifting up arms. S is for speech. The client may lose ability to speak, have slurred speech, or inability to find the correct words. T is for time. Time is crucial. Remember what time the symptoms started and relay to your healthcare provider or call 911. Stroke symptoms depend on the ischemic area of the brain and therefore vary from client to client. General symptoms may include one-sided paralysis, aphasia, dysarthria, loss of muscle control of the face or facial droop, blurred or double vision, ataxia, dizziness, memory loss, headaches, confusion, and emotional instability. An ischemic stroke can occur at any age. Those who are high risk are those who are under 1 or over 65. They may have high blood pressure, be obese, physically inactive, have a poor diet, smoke, high cholesterol, and high blood pressure. Blood clots can come from a coronary heart disease, atrial fibrillation, heart valve disease, and carotid artery disease. Precautions may include a healthy lifestyle, eating low saturated fats, preventing high cholesterol, limiting alcohol consumption, maintaining healthy weight and physical activity, as well as monitoring one's cholesterol, blood pressure, and medication management. Safety concerns with those living with an ischemic stroke would be visual motor skills, falls, infection, depression, decreased sensory, memory and cognition, and decreased motor function. Common assessments done include the Functional Independent Measure, which is for ADLs, Occupational Therapy Adult Perceptual Screening Test, which is for vision, the Mini Mental State Examination, which is for memory and cognition, manual muscle testing, as well as range of motion to assess motor. Depending on the location of the ischemic CVA, level of client factors and performance skills will vary. After one gathers all the information about your client, you can determine the location of the ischemic stroke as well as cognitive level, vision, level of assistance, family support, and more. Performance skills affected may include how one positions their body, obtains, holds objects, sustains performance, and organizes. Client factors include spirituality, mental functions, global mental functions, sensory, and neuromuscular. Environmental context includes support, as well as the client's attitude towards services. Many more as well. Personal factors may include the age, habits, lifestyles, and other health conditions. 3 ADLs a client may have difficulty with include dressing, personal hygiene, and eating and swallowing. Those living with an ischemic stroke may have difficulty engaging in ADLs, including dressing. Client may lack range of motion, strength, coordination, visual motor skills, motor planning, and the cognition to participate in a dressing task. Personal hygiene may also be affected. It may impact coordination, multi-step tasks, cognitive function, motor planning, strength, and range of motion, as well as decreased fine motor skills and manual dexterity. The client may also have performance apraxia. After having an ischemic stroke, eating and swallowing may be impaired. The client may have weakness in oral motor muscles, decreased sensation, poor manipulation of food or fluid in the mouth. They may not be able to recognize if they are hungry, if items are cold, hot, or edible. Thank you so much for taking the time out of your day to review the Ischemic CVA with me, and I hope this helps.